Hello, my name is Jeff Cooper, and I'm here to talk to you about using simulation for patient safety. First, to describe what simulation is, and to specifically talk to you about how you can use simulation to advance your patient safety agenda. By way of introduction, I'm the Executive Director of the Center for Medical Simulation in Cambridge, Massachusetts, and I'm also on the Board of Governors of the National Patient Safety Foundation, and also at the Massachusetts General Hospital and Harvard Medical School. I've been working in patient safety for almost 40 years now, and I've been involved with simulation for almost the past 20, and become to believe that it's a really important tool for patient safety. If you're going to have a career in patient safety, you'd be well advised to learn ways to change the behaviors of the many healthcare providers who need to be safer in their attitudes and actions. Yes, the major reasons for most adverse events are system-related, but people do work in these systems. In order to have a high reliability organization, that is, an organization that has relatively few accidents versus the risk that it's exposed to, the culture has to be a safe one. A safe culture has many attributes, among them being that the people are mindful about what they do, that they are constantly wary about what can go wrong, and prepared to do the right things when something does go wrong. Simulation of various kinds is perhaps one of the best ways to create and sustain such a culture. So what if you're trying to teach people a new safety behavior? What are the various ways that you can do it? Well, you can ask people to read a book. You can have them listen to a lecture like this one. You can have them be present at the lecture. They can watch a video or take a test, or they can actually participate in a simulation. If you want people to change a behavior, to really care about safety, to practice how to be safer, there isn't a better educational modality than simulation. So in the next 20 minutes or so, I'm going to give you an overview of simulation and suggest different ways that you can use it during the course of your patient safety career. I have to say, I think it's kind of odd, maybe it's an oxymoron to give you a lecture about simulation. Simulation is about learning by experience. I've come to believe that most of us don't learn too well from lectures, and perhaps least from a lecture like this one, where I can't even be in front of you to see your body language and know what you are and aren't responding to. So the best I can hope for is that something about this will stick a bit, that you'll be curious enough to go to find the simulation program affiliated with your organization and see what it's like for real. If you've never done it, go watch a clinical simulation, and if you can, go be a participant in one. That's the only way to really understand the power of it. But for now, I'm going to give my best shot at explaining the basics, the various ways in which it's used, and how far it's spread in healthcare applications. So first, what is simulation? You're probably all familiar with the fact that pilots train in simulators like the one in this picture on the left. The cockpit simulators that have been developed over the years are highly realistic and almost exactly the same as a plane. Of course, you wouldn't want a pilot practicing or fooling around, practicing emergencies, or a new pilot just to learn how to fly when you're a passenger in the plane. You wouldn't think of it. In healthcare, it's been primarily an apprenticeship until recently, and in part because we haven't had simulators. We haven't had the kind of technology and haven't used the techniques of simulation to practice. But that's really changing. In the past couple of decades, the simulation has become much more sophisticated, both in the technology, but more importantly, in the techniques. So what is simulation? What's the definition? It's a technique. A lot of people get hung up on the idea that it's a technology. Simulation is not the technology. It's the technique for interactive and often immersive activities that recreate experiences of a real-world environment to amplify or replace actual experiences. So let's take a look at a few kinds of simulators and simulations that have become more widely used in healthcare over the past 10 to 20 years. In the upper left-hand corner, we see an example of a standardized patient and a medical student here learning to take vital signs and do a basic history on the standardized patient. In the upper right quadrant, we can see a hybrid patient standardized patient simulator or trainer. In this case, we have a live patient who is playing the role of a patient who's had an amputated leg, and that's not a real amputated leg, of course, but a simulated amputation. In the lower left quadrant of the slide, we can see a part task trainer, a kind of this particular simulator for an endoscopy. There are now simulation devices for all kinds of endoscopic procedures. And in the far right, we see a simulation of a resuscitation happening in a full environment simulation simulation in an operating room. So I hope this gives you some idea of the various modalities and the ways in which simulation are being used. Very frequently, people think of simulation being primarily associated with these kinds of mannequin simulators. It's the mannequin simulators which were developed first around 20 years ago, going even further back. If you think about Resusci even 25 or 30 years ago, these mannequin simulators are what most people think about when they think about simulation, but they're really only one type of simulator. There are several companies that make these now. They come in all kinds of varieties and sizes, from the neonates to pediatric to adults, and with all kinds of abilities to have heart rate, blood pressure, eyes that open and close, pupils dilate and constrict, etc. And the prices vary accordingly depending on what kinds of features you get. So if you're in the patient safety business, if you need to make healthcare safer, and that's what you're working to do, what are the kinds of challenges in patient safety for which simulation could really be helpful? Well, let's break it down into two basic categories: training for safety, that is training the people, and training for diminishing process vulnerabilities, that is using simulation to develop and test new systems. If we're talking about using simulation for people, it's obvious the way to teach without risk to patients or providers. We don't want people practicing on us, so we shouldn't be practicing on others as well. So the simulations and the simulators that are there now really allow all kinds of teaching of procedures and techniques without any risk to patients or providers. Simulation is great for teamwork. You've had other experiences, or will, in the patient safety curriculum about the importance of teamwork in healthcare safety. It's just absolutely critical. Simulations of various kinds are just a great way to get people to think about being better team players and to change their culture and the way that they act versus with one another. In fact, simulation is just a great way for practicing just about anything that is done in healthcare, and I'll give you a couple examples in a few minutes. The other thing that's a great application of simulation is to use simulation to diminish process vulnerabilities. Anytime you're going to introduce a new system, a technology, or a procedure, you don't want to just kind of throw it into the healthcare environment. You really need to evaluate it, to practice, to try it out. And simulation, again, from the very simple to the very complex, is a great vehicle to test out any kind of new system, whatever it is, a new pharmacy system, or introducing new infusion pumps, for instance. It's using simulation of various kinds. Can you evaluate the technology if you're the one buying it, or if you're the one helping to develop it? Using various forms of simulation is a great way to learn, for instance, what kinds of mistakes users are likely to make. Another application of simulation is for root cause analysis. It's not widely used yet, but you either have or will learn about root cause analysis and its important applications in understanding how adverse events happen. But often in the root cause analysis, the analysis is done sitting around a table and drawing on a board. I've had my own experience of using simulation to actually get to the root causes of an event, and it's actually absolutely amazing how much you can learn when you reenact the event, and the more realism you can introduce, the more you're likely to learn from the providers about what kinds of things really happened that either caused the event or prevented it from being stopped. Let's talk a little bit about all the various uses of simulation, not just the technologies, but the techniques. And this comes from an article from my good friend and colleague David Gaba, who is the Dean for Immersive Learning and Simulation at Stanford. He's one of the pioneers in developing mannequin simulation starting about 25 years ago, and actually is also responsible for taking crew resource management, which is so important for teamwork training in healthcare. He's the one who really took that from aviation and applied it to healthcare. In an article in 2004, he described 11 different spectra of simulation and immersive learning. I'm going to describe 3 of those to give you a little bit of feeling about the breadth of this technique. So for the purposes of simulation, it can be used to impart knowledge for education. It can be used for training in skills, tasks, or behaviors. It can be used for testing, whether it's formative, that is just giving feedback, summative, which is actual pass-fail, high stakes for licensing, or for recurrent training. Simulation can be used in patient care, for surgical case planning, for protocol design, for equipment procurement, and there are many applications in research, for instance, of learning studying pedagogical techniques or studying human factors, which are, of course, critically important in patient safety, and also for studying physiology and pharmacology. Another one of the spectra of simulation is the unit of participation. So simulation can be used with individuals, with a single discipline, with full multidisciplinary teams, with an entire work unit, or with an entire organization. So if you're going to do a disaster drill with an entire hospital or a unit, you can use various forms of simulations to do that. Now, here's the technology of simulation and the spectra, everything from the verbal. When you're thinking about a problem and thinking through, well, what if this would happen? Or you're actually role-playing. These are verbal simulations. These are a form of simulation you call the low-tech, but actually, in many respects, these are really important technologies, even if they don't recreate the entire environment. Standardized patients, although some people might think of those as being low tech, they're actually probably the most high realism forms of simulation. That is, having actors play the role of a patient with a disease or a family member in a more full environment simulation. Then there are various kinds of part task trainers, for instance, to teach specific kinds of tasks, and I'll give an example of one of those in a minute. Then there are patient simulations where the patient is on a computer screen or a mannequin simulator or a screen-based virtual world. And then full environment simulation is where you replicate the entire clinical site or have full virtual reality with the goggles and the headset, and you actually feel like you're in the actual environment. So this gave me an example of 3 different kinds of spectra of simulation. I want to step through some specific examples so you can think about how you might use these depending on what your patient safety requirements or responsibilities are. So, and I'm going to do some of these, most of these actually thinking about in the operating room environment, because that's the world that I come from, but actually simulation is used across all the domains of healthcare. Throughout every place that healthcare providers work, there are various forms of simulation being used now. This is a full environment simulation for a preoperative briefing. You've probably all heard about the surgical checklist, which is actually a relatively new patient safety intervention. The idea of actually doing having a pre-op briefing before every operation, where people first share their names and what their role is going to be in the surgery, and then identify the patient and the site and talk about all kinds of special issues. These briefings are relatively new, and they've actually been met with some resistance. People really have to practice to do the pre-op briefing well. As obvious it is, it's still hard to get people in the operating to do this and to do it well, and actually to do it all the time. So this is a scene from a simulation center where a real operative team is practicing the preoperative briefing, or the huddle as it's sometimes called. In this program, they're then going to do a clinical simulation together, and the scenario is designed to create problems if the huddle isn't done well. It's worth noting that this doesn't have to be done in a simulation facility. Many hospitals bring a mannequin to the clinical site, presuming they can spare an operating room or an ICU or a patient room, depending on the simulation, and they run the simulation right there. This is called in situ simulation, and it's the basis for most of the simulations that are done at some hospitals now. So here's an example of using simulation with a part task trainer, a procedural simulator, for teaching how to do central line placement. So if you're involved in patient safety, one of the really important current themes today is reducing infections. One of the most important issues to deal with is the safety of, not just the safety of placing the central line correctly, but of doing this under sterile conditions. And it's been shown several times now that doing these kinds of trainings through for central line placement and using this to introduce one of the bundles has really been effective at reducing infections from central lines. Here's another example of a simulation use. Again, this one actually is an in situ simulation, and this is an example of practicing for an emergency. This is an operating room team, actually a cardiac surgical OR team, the full team. where the team is practicing with a relatively low realism, low fidelity simulation how to evacuate a patient who is on cardiopulmonary bypass. So this is no simple feat. It's hard to imagine doing it well if it's never been practiced. And here the team has actually going through the steps, and you can't see that there, but it's actually a mannequin, but a not operating mannequin on the table, and the team is practicing how they would evacuate the patient should there be a need to, for instance, from a fire or a leak from the floor above. And if you don't believe it, actually these things do happen in hospitals, and practicing for these kinds of emergencies is critical, and it's a great application of simulation. So here's another example of simulation. This is using simulation to practice before introducing a new technology or process. This is actually done in a simulation facility, but you could do this in any building. You don't need to do it in a hospital. You don't need to do it in a official simulation facility. And in this case, the scene depicts the use of simulation to practice normal and emergency events involving a new imaging technology that was being planned several years ago. It's actually an imaging technology used for intraoperative imaging. And as you can imagine, having a patient anesthetized and being operated on in an imager or an operating room could be pretty tricky. So in this case, the company engineers and the hospital clinicians and clinical engineers were able to identify issues that needed to be worked on before the technology was ready for prime time. So we've seen a couple specific patient safety applications of simulation, but a critical thing you need to think about is the actual use of the simulation. So one of the key things in doing simulations, especially for team training and especially if you're teaching people specific techniques, is to really think about how to give feedback to people, and particularly in doing team and crisis resource management kinds of training, which again you'll be learning about in other modules of the patient safety curriculum. You've got to really learn how to do debriefing. This is not something for amateurs, although amateurs do dabble in it. You really have to learn how to debrief well, because it's the key to learning from simulation. Many people say that the simulation is actually an excuse for the debriefing, again, especially for simulation for teamwork training. The debriefing is a place where the entire team, after a simulation scenario, can sit and usually with video replay can look at their behaviors, can talk about how they acted together, the kinds of things they did, how they worked as a team, the kinds of mistakes that were made. And it's there that the learning often really happens, where people really think about their actions and what they did and have a open, non-threatening dialogue. If you are going to get involved in simulation, getting training about debriefing is absolutely critical. So let's talk briefly about what is the status of simulation in healthcare. The modern era of simulation started about 20 years ago, although the roots can be traced back to actually around the late 1960s. But the modern era is about 20 years old. There are now thousands and thousands of mannequin simulators around the world. There are probably 2,000 to 3,000 various kinds of simulation facilities and programs, depending on what you call it. But simulators are in essentially every large hospital now, certainly every academic hospital and medium-sized hospital, nursing schools, schools for allied health professionals, community colleges are using simulation of various kinds for the allied health professions. And this is a picture of the Israeli Center for Medical Simulation, where there's a large simulation center that serves the entire country, and also other smaller simulations around the country. Virtual hospitals like this are being built around the world, and simulation is really becoming deeply rooted in all of healthcare, where people are understanding how important it is to have a culture where people don't practice on patients, where we practice first in simulation. And to indicate how widespread simulation has become, the Society for Simulation in Healthcare was established about 10 years ago. It already has about 3,000 members. There's a journal, Simulation in Healthcare. I should say my conflict in that I'm one of the associate editors, but I urge you both to look up the Society for Simulation in Healthcare and to look at the journal to see the kinds of issues that are being discussed in this new modality of education and training. So people ask, how do we know it's worth spending money on this? Where's the evidence that simulation really pays off? So again, I turn to my good friend and colleague David Gaba, who in 1992 wrote that no industry in which human lives depend on the skilled performance of responsible operators has waited for unequivocal proof of the benefits of simulation before embracing it. Neither should anesthesiology, and of course that applies to all of healthcare. It's interesting, there's not a lot of, and almost no evidence, certainly no randomized controlled trial, that simulation pays off in aviation or nuclear power, but nobody would think about practicing that way, and certainly we shouldn't in healthcare. One of the really great examples, although it's one of the only examples of how simulation-based, in this case crew resource management kinds of training lowers the accident rate, was published in a proceedings actually back in 2001, and this was not a peer-reviewed journal, but it's a great example of how CRM with simulation lowered the accident rate in Army aviation. If you look on the left, that's the accident rate per 100,000 flying hours before the introduction of what was called ACT, Air Crew Training with simulation. And after the introduction of the the accident rate dropped dramatically. And then, for some reason, the money ran out in the program, and within a few years, they were back to the same accident rate. But this is a dramatic illustration of what the impact of both CRM and simulation training can be. So I hope I've convinced you to really look into simulation more and to really think about it for applications in whatever patient safety area you're working in. If you're looking for more information, go to the Society for Simulation in Healthcare website. Also in Axel as an example of another simulation organization, the International Nursing Association for Clinical Simulation and Learning. And there is a list, a database of simulation centers in the Bristol Simulation Center website. There are actually about 20 simulation societies around the world, if you can believe that, of various kinds. So I suggest to you simulation is a great tool for patient safety. Go out there and find one and do it. Thanks.